right, I'm back once again with Dr. Benjamin Marcum from the Stephenville Medical and Surgical Center here in Stephenville. Dr. Marcum, thank you for joining us again today.
Pleasure to be here.
Yeah, and I wanted to ask you, first of all, just kind of right off the bat, I wrote this down. Tarrant County has issued an order requiring face masks in businesses and at outdoor gatherings of more than 100 people. And you and I have talked a good bit about face masks at this point. And do you see anything like that happening in Stephenville? I know Stephenville and Tarrant County are very different, but...
Actually, the mayor and the county judge are taking this issue up today.
Okay.
Dr. Kelly Doggett wrote an open letter to the judge and the mayor, encouraging them to require people to wear face masks, at least at the 4th of July festivities that are upcoming, if we go ahead and have those, and then hopefully in businesses as well.
Yeah.
The preponderance of evidence about masks is that masks prevent the spread of COVID-19.
Yeah.
In fact, the Aggies just released a study down at Texas A&M in the last couple of weeks where they proved unequivocally that the mask decreased the spread of the virus. And then Texas Tech even did a study not too long ago that said, they kind of projected how things will go and projected how many lives will be saved if people just in general wear masks.
Really?
And the numbers are staggering.
Yeah.
And so masks, I have people asking me about vaccines. I have people asking me about treatments for COVID-19. And those things are all coming and they're developing and they take time. But something we can do right now today to help save lives is wear a mask.
Yeah.
And so, I think those are other important things to think about. But right now, we just need to wear masks.
And, this might be a little out of left field, but for people in town who might not have I ordered a mask online, but for someone who might not be able to do that, are there any resources out there to get a mask?
Absolutely. You can get on the CDC website and learn how to make your own. And there are many studies that actually evaluate what home fabrics make the best mask.
Really?
Whether you layer it. In fact, like some quilting material with a little bit of cotton batting in between actually makes a very good mask and will stop most respiratory droplets.
Okay.
And so there's lots of literature out there if you look for good quality sources to help you either fashion your own mask or, just driving around town, we noticed that there are several stores that are advertising that they have masks available. You can just go buy a box of surgical masks. Those things are becoming much more available with time. And so really, there's not an excuse for anyone not to at least wear some sort of face covering.
Yeah.
And most people have some materials in their home and can readily find the information on the internet about how to use those materials to protect themselves and the people around them.
Okay, so it is possible, no matter what, to be able
Absolutely.
to wear a face covering.
There's really no excuse.
Yeah.
Right.
Well, I wanted to get into the current numbers here in Stephenville. They have risen dramatically over the last couple of weeks. And a few weeks ago when we were speaking, you had said that the numbers at that point are kind of expected. Would you still say that now?
I do.
Okay.
Our community has not socially distanced. They have not adopted masks. They have kind of returned to business as normal. We have a large number of people in our community that think COVID-19 is no big deal.
Yeah.
And that everybody's going to get it eventually, so you might as well just go live your life and go on.
Yeah.
Well, we have that attitude. You're going to have an increase in cases. It's just simple math. This virus is not political. It's not motivated in any other way except for it wants to replicate and infect other people and replicate again.
Yeah.
That's all it wants to do. And so if we provide the virus that opportunity, well, then it's going to happen. That's just what happens.
Yeah.
It's cause and effect. There's just no way of getting around it. And so if you provide fuel for the fire flames. And that's what we've done.
Yeah. And, what would you say would be your biggest concern about the current rise in active cases?
We only have 4 ventilators at our hospital.
Yeah.
I'm sitting here in the hospital parking lot going in, about to round on a patient. Last weekend, Texas Health System in the Metroplex was on divert. They didn't have any beds for patients last weekend already.
Really?
If we have patients who are very sick with COVID-19, it's a very real possibility we will not be able to transfer you. And if we have 4 patients on a ventilator and we don't have another ventilator, then we're going to have to do our best.
Yeah.
And so, in Harris County down in Houston, they have adults being admitted to the children's hospital because they're out of beds in the adult hospital.
Really?
And so, overwhelming the medical system is still a distinct possibility. and I do not want to see a tent hospital set up in our emergency department parking lot with brought-in ventilators from the National Guard because our community was flippant about the danger of this virus.
So, yeah, even if people during that kind of month-long lull back in April, May got kind of complacent about it, you would say it's kind of time to really start engaging again and kind of keeping yourself safe.
Right. It's probably not still too late. I hope it's not.
Yeah.
The number of cases that we're diagnosing in our clinic at Stephenville Medical Surgical Clinic daily is rapidly increasing.
Yeah.
And we have the tent clinic out in the back where we're doing all of our swabs. And there for a while we were seeing, 10, 15, 20 people a day in the tent clinic because that many people had symptoms or had, only that many people had symptoms or had been exposed.
Yeah.
Today at lunchtime, my receptionist just came and told me we have 97 patients scheduled in our tent clinic.
Really?
So that's 100 patients who are getting swabbed at our clinic today.
Yeah.
Because they have symptoms or were exposed to someone with COVID-19. And so it's almost got to the point where pretty soon we're not going to be able to handle the volume at the clinic.
Yeah.
Unless we're going to have to try to rework how we do things so that we can continue to handle that volume.
And there is some free testing going on in town right now. Do you see have you seen that, or do you think there are large numbers of people going there as well?
Not yet. Monday they're doing free testing at Cornerstone Church.
Okay.
That is kind of come periodically. If you pay attention to the county judge's website, they kind of keep updated when that comes. It's kind of sporadic. There's not a regular schedule. To this point, we haven't had a lot of people take advantage of that testing, but I imagine with the spike in cases, we'll have a larger turnout this coming Monday.
Yeah.
And then, everybody's doing what we can to get the word out to let people know that testing is available. But yeah, that's put on by the National Guard. It's a little bit problematic because the way the patients get notified is that the National Guard is supposed to notify the patient's primary care physician that they write down, and so it's a little bit difficult, to try to get to connect those dots, if they don't get the phone number right or get the right doctor or whatever. And then the primary care doctor is supposed to be able to follow with the patient and get those results. And so I'm not real excited about the way that those are reported.
Yeah.
It's not a great way to track. But at least the testing is available, and we do the best we can with it.
Yeah.
I much prefer patients just come get tested at the clinic so that they establish a relationship with the physician and get it done. We have a way to do a free test where you can find out the result in about 24 hours.
Okay.
But usually there's an associated office visit cost if you come to the clinic.
Okay.
If you go to Cornerstone Church, it's just free. You're just going to walk up and get tested.
Really? Okay. But less tracking and less kind of contact with the doctor to kind of help you move forward with that result. Right.
Mm-hmm. Yeah, it's a little bit more difficult for us to advise a patient, without having that doctor-patient relationship if you just go get randomly tested. So the other thing that I'll mention about testing is if you were exposed, say I was exposed to someone yesterday, it does me no good to get tested today.
Yeah.
There's almost no way that I'm going to be shedding virus today.
Okay.
The average incubation is somewhere between 4 to 10 days. And so if I were exposed and asymptomatic, I probably wouldn't I would quarantine, but not test myself until around 7 or 10 days.
Okay.
Now, if I developed symptoms before that, I would go ahead and go get tested.
Mm-hmm.
But if I didn't have symptoms, I would wait a while to see if that virus is going to start shedding and quarantine in the meantime.
Okay, so that's the time to quarantine yourself and keep yourself away from other people, but wait to see if you actually do develop symptoms.
Right.
And if you never develop symptoms, would you say, so you would say get tested either way, even if you don't develop symptoms?
Yeah, get tested either way. Yeah, about 10 days, and then if that's negative and then you're still asymptomatic at day 14, then you can resume your normal activity.
Okay. So one last question I had. My wife is a kindergarten teacher here in town. My son's actually going into kindergarten. They released some notes on what they thought the school year might look like next year, coming up in August. And, there were multiple options. And one of those was just standard face-to-face class. And what do you see? I know that's not necessarily your field there, but what do you see as some of the risks, or do you see that happening, going to standard face-to-face class in the fall?
If we resume normal school and resume Tarleton normally, and all these kids come back and they all start to see each other face-to-face, we're going to see an explosion of cases. it's that mathematical problem that we were talking about.
Yeah.
You know, you just open the floodgates and fuel the fire, and we're going to see an explosion of cases.
Yeah.
And so we just need to brace ourselves for it if that's what we choose to do. And you know, I understand the complexity of this decision, and I imagine that the school district's decision about what they're going to do is going to be a midnight hour decision, depending on what the current caseload environment is like when we get to August. You know, I mean, there is no way that they can predict in June what school is going to look like in August, depending on how many cases we have through the summer.
Yeah.
But I think regardless of what happens through the summer, if you resume 22 kids in a class without masks, sharing pencils and all this stuff, I mean, you know, school's a petri dish. You know, you send your kid to school, they're going to come back with five or six colds. And this is essentially a cold on steroids that kills people. And fortunately, the kids don't get too sick, but they're little vectors, and then they're going to go stay with their grandparents and get their grandparents sick. And so, you know, there's not a good answer.
Yeah.
You know, people are understandably angry and upset and stressed, and they want to vent that anger. And I'm seeing it vented in a lot of negative ways. When it comes to just, you know, arguing about whether or not they're going to wear a mask, or the government telling me what I've got to do, and blah, blah, blah. That, you know, railing against the government, railing against the medical system is not productive. They're not the enemy. The enemy is this virus.
Yeah.
And there's just not a good way for us to handle it. We're either all going to get sick at once and overwhelm the medical system, or it's going to drag on for years and devastate our economy and our education system. I mean, we're in a pickle.
Yeah, for sure.
There's no other way to say it. There's no other way to say it.
Yeah, and I mean, you know, we're kind of getting to the point here in Erath County where even people who don't quite believe what's going on is a big deal, or don't want to wear face masks, or are trying to make it maybe political, it could be about to hit a little closer to home, you know.
Yeah.
For a lot of people.
You know, it's amazing how your politics take a back seat when one of your loved ones is intubated and prone in the ICU.
That's right, yeah. Yeah. Well, Dr. Marcum, thank you so much again for joining me today. I hope to have you back on in a couple of weeks and get an update then. And I hope things are a little more stable, but, you know, based on today, it doesn't quite seem like that might happen. But we do appreciate you kind of being a voice for our listeners to get current information.
You know, my pleasure. The main thing we got to do is not panic and just be smart about what we do and move forward.
All right. That's Dr. Benjamin Marcum with the Stephenville Medical and Surgical Center. Thank you for joining us today, and we'll be right back.